As Michael Jackson's memorial service prepares to get underway, the noose may be tightening on the doctors who may have fostered Jackson's drug dependence. Federal drug regulators telling FoxNews.com that Jackson's personal physician, Dr. Conrad Murray, this is the guy who described Jackson as one of his best friends, was not even licensed to prescribe controlled drugs in California. So how on earth was he giving Michael medications if in fact he was, as the reports indicate? Well, addiction specialist Dr. Hal Urschel joins us on the phone. He is the author of Healing the Addicted Brain. Dr. Urschel, good morning to you.
Good morning to you.
All right, so this guy was licensed in Nevada and some other states, but not in California to prescribe controlled substances. So for him to give Michael Jackson a prescription for any of these drugs, which we've heard may have been used by the pop star, would have been illegal?
Yes, it would be against the law. You get a DEA number from the United States government at the federal level, but then each state in which you practice medicine, you also have to be certified and licensed by that state to prescribe medications specifically in that state.
Okay, but the drug that they seem to be focusing on, at least for now, at least with respect to Michael Jackson's death, is propofol, which is a drug that's used in hospitals. Is that, my understanding was, that is a drug that's not on the banned controlled substances list because it's in hospitals. It's not a drug that people generally abuse. In other words, they hadn't really thought of it. Is that true?
Yes. Well, propofol is a very effective medication when used in the hands of a licensed anesthesiologist or a nurse anesthesiologist. However, when used in any other hands by any other physician, it's a very, very dangerous and deadly medication. And so I think that the licensing agencies would probably not have considered it to ever be needing to be licensed outside of a hospital setting, because in most hospital settings only allow the anesthesiologist to give it, and only in a surgical or an operating room environment.
So if Dr. Conrad Murray, this is the reason I ask if is because he gave an interview to TMZ.com and he denied giving specific drugs. The TMZ went down the list with him. Harvey Levin, this drug, no. This drug, no. Then they said propofol, and he said, this is the lawyer for Conrad Murray, I should say, said, I refuse to comment on propofol, which of course leads everybody to believe he actually gave him propofol. And of course, the reports are from the LAPD that they found propofol in Michael Jackson's home. Obviously, the authorities are going to talk to Dr. Conrad Murray some more about this drug. So if in fact he was giving him propofol, even though he wasn't allowed to prescribe controlled substances in California, might he have a loophole here, doctor, since this drug may not have been on the banned list of prescriptions?
Well, again, if he does not have a license to practice medicine in California, then no matter what medication he's giving, again, that would be illegal. I'm not specifically familiar with the laws of California. However, again, coming back to propofol, it is a very dangerous medication. And even the other medications they were asking about, Demerol and fentanyl, those are a lot safer medications. As dangerous as they are in the wrong hands, they're a lot safer medications than propofol.
How would this have worked if, we're told Michael Jackson had sleep problems and had difficulty falling to sleep. If he wanted propofol, which according to his nutritionist too, she says she called and begged him to get her hands on that drug and bring it to him, and she refused shortly before he died, a couple weeks. In any event, if he persuaded Conrad Murray to give him propofol, how would it have worked inside that house?
Well, again, you should only be giving propofol within a hospital setting.
Right. We know it wasn't proper, but how would he have had to do that?
It's only delivered IV. It lasts for a short time. And when it does provide sleep, it provides a very unusual form of sleep. And so it would be something that I don't think any physician in their right mind would be prescribing to a patient that's asking for sleep. It is a medication that knocks you out for an anesthesia component of a surgery. That's all it does. You should not be using propofol for a sleep medication.
There are some questions about this guy, Conrad Murray, was the one who found Michael Jackson when his heart had almost stopped. His breathing was very slow, tried to revive him and failed to, of course. And there are questions some have raised about why the doctor would have gone into Michael Jackson's room to check on him in the first place, leading some to believe indeed he did administer this drug and perhaps was just checking on his patient to make sure everything was okay, which indeed it was not. Would that have been possible? Could you give somebody propofol, walk away, come back an hour later?
I mean, again, that you definitely could do that, but that would be very poor and dangerous medicine. Anesthesiologists that are giving this medication in the operating environment are monitoring the respirations and the heart rate on a minute-by-minute basis. So I can't imagine that you would leave the room for any length of time, especially when you're not in a hospital setting. But again, giving it in the first place for sleep is a very, very inappropriate use of the medication, obviously a very dangerous This is a very dangerous medicine when used in the wrong hands, and unless Dr. Murray was an anesthesiologist, he really had no ability to prescribe it in a safe measure.
Yeah, which he was not an anesthesiologist. He was a cardiologist, and he wasn't board certified. And he got hooked up with the family, reportedly, because one of Michael Jackson's bodyguards got him on the quick when Michael Jackson needed a doctor a few years ago, very quickly, and he would come in the middle of the night, and then suddenly they became friends. And the reports are that this guy was making $150,000 a month. That was the latest report that he was offered. $150,000 per month for the duration of this concert series Michael Jackson was going to do in London.
Again, there's so many safe sleeping medications that are effective. And I can't imagine why, as an addiction specialist, all this is pointing towards the fact that there probably was an addiction issue going on, because you're needing stronger and stronger medications to put you to sleep, and that comes with in the normal course of addiction. Again, there's a whole lot of misinformation, a lot of unanswered questions out there, but the fact that he was using a very dangerous medicine in a very inappropriate way, in a very in a non-hospital environment, all raises major questions in my mind.
Yeah, well, the LAPD are saying he is a cooperating witness for now, Dr. Conrad Murray, not a suspect, but they never call you a suspect in these cases until they arrest you. So we'll see what happens. Dr. Urschel, thanks so much for your expertise on it.
My pleasure. Thank you.